Can you hear me? Is that okay? Thank you
Yep.
very much. Good afternoon, everybody. I can see that maybe in Brazil it's almost good evening. It's a pleasure to me to be here with you in this prestigious Congress Hbicom. This is my first time here, and I would like to thank the organizing committee and especially Professor Jorge Garay for inviting me to the Congress. So this afternoon, I would like to tell you a little bit about laser therapy and its effects or possible or potential effects to help in the pandemics of COVID-19 and some other lung inflammation. So I will tell you and show you some results of our group and from different groups around the world, and our experience with laser therapy with inflammatory lung inflammatory disease. So first of all, laser therapy has been used in the last 51 years since 1970, when Andre Master firstly demonstrated biological effects of laser therapy. So we have around exactly 51 years of research in laser therapy. So it's interesting to say that, because it's just to demonstrate that laser therapy is not an alternative therapy, but it's also very well and very consistent therapy, especially for inflammatory disorders. So what we have in our days with the pandemics of COVID-19 is that we have one of the main points of the pandemics is the massive lung inflammatory reactions with a cytokine storm. These are the main problem in COVID, and these effects are killing people, millions of people around the world. So what I'm going to show you is that the effects of laser therapy, how laser therapy can help the pandemics or the lung inflammation or the COVID-19 sequela, and how we can treat these effects of COVID-19. So I'll give you a lot of evidence that yes, laser therapy can be very helpful to treat effects of COVID in lung inflammation. So these are the one recent hypothesis for the lung inflammation in COVID. So we have the cytokine storm activating T cells, activating inflammatory cells, and increasing capillary permeability. So expression of several inflammatory mediators and destruction of alveolar epithelial cells. So the first study that I show you to help with our evidence was published in 2005. And that year, Aimbiri et al. Demonstrated that laser irradiation was effective in reducing bacterial lipopolysaccharide-induced hyperactivity in the airways, mainly in trachea. So in addition to inhibiting the influx of neutrophils into the lung and the production of cyclooxygenase-derived inflammatory mediators in bowel fluid and also in lung tissue. So this study from our group was published in 2005. So this was the first, since we know, the first evidence that laser therapy or laser irradiation could help in lung inflammation. This was a model of bacterial-induced hyperreactivity. So it's experimental model, like maybe we should say that it's a little bit similar to pneumonia. And so this was the first time that we demonstrate laser therapy was able to reduce lung inflammation or upper airways hyperreactivity. In this paper, we can see here in this graph that bacterial toxins induce a very marked hyperreactivity of the lung, of the airways, and that laser therapy was able, we can see here in the dotted line, laser therapy was able to reduce the hyperreactivity induced by bacteria in the airways. We also demonstrated at that time that laser therapy was able to decrease the inflammatory infiltration, the inflammatory cells infiltration in bronchoalveolar lavage, in bowel fluid, when we wash the airways. So we can see here in the black column, the inhibition of inflammatory cells in lung wash in bronchoalveolar lavage fluid. So it was very effective to reduce inflammatory cells in the lung. We also showed that prostaglandin E2, that's a very important inflammatory mediator in all kind of inflammatory disease. We can see again that after 6 hours, 24 hours, and 48 hours of the inflammatory stimuli, we could see that laser therapy was quite effective to reduce prostaglandin E2 production in the lung. So this were the first evidence that laser therapy can reduce lung inflammation. In the following to this paper in 2006, we could show that again in another experimental model, now with rat diaphragm muscle, that laser therapy was able to restore diaphragmatic force. So when we can see that bacterial toxin was able to reduce diaphragm force or diaphragm muscle activity, and laser therapy was able to partially restore the muscle force. Besides, we could also demonstrate that the important cytokine TNF alpha, that's one of the bad thing or the very harmful cytokine, especially in COVID-19 disease. We can see here that laser therapy irradiation of the lungs, of the tissues, was able to reduce TNF alpha production. We can see here in the dot columns the inhibition of TNF alpha. In 2006 and 2007, Hbicom colleagues that from my group, we demonstrated that laser therapy was able to restore then a normal tracheal smooth muscle relaxation and also normalize the contraction of diaphragm. In another experimental model, for example, of immunocomplex lung injury, that's an immunological reaction with marked hemorrhage in the lungs. We also demonstrated that laser therapy was effective in inhibiting the expression of TNF alpha in the lungs. So TNF alpha is it's a very, as I told you, it's a very important and very harmful inflammatory cytokine that's important, especially in lung disease. So this is another paper that we demonstrated that low-level laser therapy restore muscle relaxation of airways again, and this also reverts the effects of TNF alpha in airways. So we can see here For example, how TNF-alpha induce hyperreactivity of the airways in the left panel, and how laser therapy reduce TNF-alpha production in the lungs. I can see here in the right panel. We can see in the black squares the reduction and or partially inhibit the TNF-alpha production in the lungs. So laser therapy also was demonstrated again in 2006 in another paper that laser therapy was very effective to reduce TNF-alpha in the lungs. So we can see here we were able to quantify TNF-alpha, and we can see here the very marked production of TNF-alpha by bacterial toxins. And we can see that laser therapy again, then we were able to exactly measure the amounts of TNF-alpha in the cells, and we could demonstrate that laser therapy was able to reduce or significantly reduce TNF-alpha production. So what I'm showing you is that TNF-alpha is one of the worst or one of the very dangerous cytokines that is also involved in the deaths or in the inflammation of COVID-19. So this is the reason that I'm insisting to show you the effects of laser therapy to reduce TNF-alpha in the lungs. This paper was published in 2007, and here we demonstrated that the immunological reaction in the lungs that is very much characterized by hemorrhage in the lungs. This is also one of the effects of COVID-19. So we can see in this paper that I can show you here that the hemorrhage index was very much reduced by laser therapy, besides other inflammatory mediators. And you can see here, that's also the neutrophil infiltration in the lungs as well by the immunoreaction. And we can see here in the right side, laser therapy was very effective to reduce inflammatory cells in the lung in the same model. After that, in 2013, the group now of the professor, he already finished the PhD at that time, Professor Flavio Imbiri, he demonstrated that laser therapy was again responsible or was able to restore the effects of intestinal ischemia and hyperfusion injury in the lung. This is a very classical model when you induce an ischemia in the gut, in the intestine, and then this is how can I say? This is very important. This ischemia is responsible for a very strong inflammation in the lungs. So it's a very classical model of ischemia and hyperfusion of intestine, and that is responsible for a very strong inflammation in the lungs. So in this model, Professor Imbiri demonstrated that laser therapy was able to restore hyperreactivity. So you can see here, so this is the control hyperreactivity graph. We can see the increases in reactivity of the airways. We can see here the control group is the white squares, and we can see increasing reactivity after ischemia and hyperfusion in the inflammation of the lungs. And then we can see when we treat with laser therapy the inhibition of hyperreactivity. We can see here the control group is the black square, and then the hyperreactivity is the upper line, and then in the middle we have laser therapy or laser treatment. So laser therapy after 4 hours of ischemia in the intestines, it was able to reduce hyperreactivity in this other experimental model. They also demonstrated that laser therapy was able to reduce edema in the lungs. So this is the results of pulmonary edema. So we can see here in the dotted columns are the laser therapy, and the black column is the inflamed lung. So we can see a very significant inhibition of edema, pulmonary edema, in this experimental model. In 2013, again, the same group published that low-level laser therapy restored the oxidative stress. So as we know, oxidative stress or reactive oxygen species, we call also free radicals, are responsible for cell death and partially responsible for cell death in inflammatory response and disease. And we can see here in this paper that I think it was the first time that people demonstrated laser therapy in the lung was able to reduce oxidative stress. So it's very interesting because we also reduce cell damage. So we can see here in the upper panel to the left here, we see neutrophil migration. We can see that laser therapy is very effective to reduce neutrophil inflammatory cell migration and pulmonary edema in the lower panel again. And this is lung histology. It's a very clear to see the difference. It's very easy to see the difference. We can see in the left image here is a control or healthy lung. We can see in the middle the inflamed lung, and we can see at the right image the inflamed lung after laser treatment. So we can see that the left and the right image are very similar. So we can see that laser therapy was effective also to prevent lung remodeling, lung alterations in the experimental setup. Again, another study demonstrated that laser therapy attenuates myeloperoxidase activity and inflammation. This again is the ischemia and hyperfusion model. But this is very important because in this paper, we can see a number of cytokines, important cytokines, very important cytokines that are also involved in all kinds of lung inflammation, especially in the COVID-19 as well. So we can see that interleukin or IL-1 here in the upper panel. We can see gene expression to the left and direct measurement in the right graph. So this is interleukin 1, IL-1. So we can see that laser therapy was able to reduce gene expression of the interleukin 1. So this is very important to inhibit the production of IL-1. We have here IL-6 or interleukin 6. Again, laser therapy in the 4 dotted columns, we can see laser therapy in different doses. So all the 4 doses in 4 energy doses, we can see in 4 columns the inhibition of interleukin 6, both the gene expression and the dosage, the mediator. In the third panel here, we can see TNF alpha again. So it's very important to see the 3 most important cytokines in lung inflammation can be reduced by laser therapy. Okay, so we see in the left panel is the gene expression of TNF alpha, and in the right panel is the direct measurement of the mediator. And in the left, in the last lower panel, we can see interleukin 10. It's important to say that interleukin 10 or IL-10 is an anti-inflammatory mediator. On the contrary of the other three that I showed here, IL-1, IL-6, and TNF-alpha, that are pro-inflammatory mediators that were inhibited by laser therapy. IL-10 or interleukin 10 is an anti-inflammatory cytokine. So we can see that laser therapy is able to increase the expression of an anti-inflammatory cytokine. This is very important. More recently, in 2016, in another experimental model of allergic disease, allergic lung disease, just like asthma, for example. So I already showed you bacterial inflammation, like pneumonia. I showed you immunological reaction and hemorrhage in the lung. I showed you ischemia and reperfusion of an intestinal ischemia and reperfusion that induce an acute lung inflammation. And now I'm showing you an experimental model of allergic inflammation. So it's very important to see that we already saw 4 different situations of lung inflammation. In all of them, laser therapy was able to reduce or to inhibit the inflammation in the lung, and also to restore the functions of the lung. So here in 2016, the group of Professor Hbicom showed that laser therapy was also effective in allergic inflammation. As we can see here, for example, in the right graph, we see the eosinophil infiltration. So eosinophil is one of probably the most important leukocyte in allergic lung inflammation, like asthma. So eosinophil is the most important leukocyte in asthma in the lung. So we can see here the control allergic animals. We can see in the black column is the allergic animals, and in the dotted columns we see allergic animals treated with laser therapy. So it's a very marked, it's a very important, very easy to see the effect of laser therapy in allergic inflammation. So yes, if you ask me that can I use laser therapy to treat asthma? Yes, you can. You can help your patients. You can maybe not treat only with laser therapy, but for sure that laser therapy has a potential to help your patients. So this is important technology, important to say. So again, we can see lung histology. So it's it's very easy to note the difference between the groups. We can see in the left a control group, a healthy group. We can see in the middle how is the lung of an allergic individual subject. We can see, so in the middle is the allergic one, and in the right panel we see allergic individuals treated with laser therapy. So we can see again in allergic model of lung inflammation that mimics asthma. We can see that laser therapy was effective, is effective to prevent lung remodeling. It's very important because allergic people, asthmatic people, because it's a chronic inflammatory disease. We see that the asthmatic lungs can be remodeled by the disease. So it's important to see that laser treatment was able to prevent lung remodeling. So I can see here it's another important thing for people in the engineering that are not much familiar with that. But ICANN one is well, as what we call adhesion molecule. Adhesion molecule. What is an adhesion molecule? It's like a protein that is expressed in the cell surface, where you have an inflammatory disease that allows the leukocyte to bind to the lung tissue and to infiltrate to the lung tissue. So the leukocyte comes from the blood vessel, comes out from the blood vessel to infiltrate in the lung and induce lung damage, induce lung inflammation. So it's this adhesion molecule is very important in the reaction. So as we can see here, laser therapy was able to reduce the expression of adhesion molecule. So the effect was very significant. And then it's another point that we should demonstrate or highlight to you. Okay. In this same study, we could see here in the upper panel to the left, reactive oxygen species, free radicals, okay? So we can see that in the left panel that laser therapy reduced significantly the production of free radicals responsible for cell death. RUNT is another inflammatory marker. We can see that laser therapy was also able to inhibit. Other chemokines, CCL6 and eotaxin, we see the inhibition. And here we can see the important antioxidative enzymes. Very interesting to see that, for example, in the right panel, the upper right panel, we see here T-bars. What is T-bars? T-bars, it's a marker of oxidative stress in lung tissue. In this case, in lung tissue. So we see that laser therapy decrease T-bars, so decrease oxidative stress in the lung, and consequently decrease cell death. The death of lung cells, pulmonary cells. Okay. We also demonstrated, we also see in this paper that SOD, superoxide dismutase, was significantly increased. Antioxidative enzyme is increased after laser therapy. In the left panel, SOD, superoxide dismutase. In the right panel, glutathione. It's another antioxidative enzyme. We see again stimulation of the antioxidative enzyme by laser therapy. And in the lower panel, again, glutathione reductase. We see the stimulation of another antioxidative enzyme. So three antioxidative enzymes are increased in activity by laser therapy. This is so much important because when you increase the activity of antioxidative enzymes, you decrease cell death. You decrease cell death in the lung. So all of this evidence, we have more. I'll show you a little more. This is a paper from 2018 in chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease. So again, recapitulating, I show you I'll show you pneumonia, bacterial inflammation, ischemia reperfusion, asthma, immunological disease, and now I show you chronic obstructive pulmonary disease. Again, we see in dotted columns laser therapy inhibiting all the parameters. All the parameters. Total cells, total leukocyte infiltration, macrophages, neutrophils, and lymphocytes were inhibited by laser therapy in the lung, in the lung inflammation of chronic obstructive lung disease, pulmonary disease. Again, mononuclear cells and polymorphonuclear cells and the histology. On the left is the normal group, in the middle is the inflamed group, and on the right is inflamed treated with laser therapy. So we can see again in this other model of lung inflammation that laser therapy was very effective to help to decrease inflammation, to decrease cell death, and again, cytokines. I should remember you that the cytokine storm is the evil, is the worst part of COVID-19 in the lungs. Cell death, inflammation, cytokine storm, and what I am showing you is the laser therapy is able to reduce all of these things. And again, I show you cytokines. Interleukin 6 was inhibited by laser therapy. Interleukin 1 was inhibited by laser therapy in the right. Interleukin 17 was inhibited by laser therapy. TNF alpha inhibited by laser therapy. Chemokines inhibited by laser therapy. And interleukin 10, the anti-inflammatory cytokine, was increased. So you decrease inflammatory mediators and you increase anti-inflammatory mediators. This is very, very, very important. And again, we show you the histology of the lung, and we see in this graph the collagen deposition. Collagen, in this case, in the lung, is bad. When you see collagen, the increase in collagen in the lung, you see that the normal functional cells are being, how can I say, remodeling. There is a remodeling of the lung, the normal lung tissue by fibrosis, by collagen. So laser therapy was able to decrease collagen deposition in the lung, as you can see in the graph and in the histology. We see in the left normal tissue, we see in the middle the inflamed tissue by obstructive lung disease, and we see in the right the laser treated group. Okay, laser therapy was able to decrease fibrosis of the lung. So now in 2020, the group of Professor Ana Paula Oliveira demonstrated that idiopathic pulmonary fibrosis was inhibited by laser therapy. So this is a very recent paper. And again, in another, I think it's the 50th or 60th model of inflammation in the lung that I show you. So we can see again TNF alpha, interleukin 1, interleukin 6, chemokines, interferon, and interleukin 10 increases in interleukin 10. So it's another model of lung inflammation, and we show you this evidence that laser therapy was able to prevent fibrosis of the lung. And you can see here, again, the histology, normal, healthy lungs in the left, the fibrosis of the lung in the middle, and laser-treated group in the right. So it's a very marked effect of laser therapy in the lungs. So we cannot neglect that laser therapy is very effective and important to treat lung disease. But not only. I'm almost finishing, and we can see here that not only the local stimulation of the lungs, not only the local irradiation of the lung, but also what we call transcutaneous irradiation. This is another modality of laser therapy that we do normally in the artery. We irradiate the blood. We irradiate the circulating blood. Okay, we put the laser therapy in the radial artery, and we irradiate for 30 minutes the blood. So this is an experimental model in rats where the authors irradiated the tail artery of the rats. Okay, so we can see that irradiation of the blood that we call ELIB or ILIB or modified ELIB, that because the original ELIB was the intravenous irradiation of the blood, but now we don't do intravenous in our days. We do transcutaneously. So we irradiate the artery. So we irradiate for 30 minutes, and then we can see the results. We can see here the inflammatory reduction, the inflammation. This is a bowel fluid. That is the bronchoalveolar lavage fluid. So we can see the inflammatory cells were reduced in the lung fluid. Okay. And also the histology was interesting. So this is an asthma model in rats. So we can see again the histology that mast cell degranulation was decreased, and we see an interesting effect in the lung at only irradiation, the blood, the circulating blood. And also here we see the reduction of some cytokines. And again, in another paper of 2021, the effects of transcutaneous stimulation in the irradiation of the blood again in acute lung injury. So we can see the inflammatory cells in the bowel fluid. So this is the black column. Okay, leukocyte infiltration in bronchoalveolar lavage and lung tissue. So we can see that it was very much inhibited, very significantly inhibited by laser irradiation of the circulating blood. So we also have interleukin-6 that was reduced, interleukin-17 that was significantly reduced, interleukin-1 significantly reduced, and interleukin-10 significantly increased, the anti-inflammatory mediators. So what I try to show you, so again, at the gene expression and quantification of the mediators. And then we have a clinical trial, a very recent clinical trial of evaluation of photobiomodulation for COVID-19 pneumonia. So we see in this is the hypothesis that showed in the beginning. And we can see here that laser irradiation was very significant to increase the status of the patients. We can see in the red column. So this is the benefit of laser therapy in COVID-19. This is a clinical trial, not rats. So it is a 2020 study. And we can see here the conclusions of this clinical trial was that there was no incidence of mortality or major reported side effects in photobiomodulation group. The mortality rate was 40% in the control group, and 40% of patients continued to experience pulmonary sequelae. The patients in the photobiomodulation group recovered without needing of artificial ventilation. Conversely, 6% of patients in the control groups needed artificial ventilation. So laser therapy was effective in a clinical trial of COVID-19 pandemic. And now, recapitulating laser therapy was effective in asthma, chronic obstructive pulmonary disease, smoking disease, pneumonia, bacterial pneumonia, COVID-19 and sequela, and oxidative stress and cell death. So, in conclusion, laser therapy presents very strong and convincing scientific evidence about its beneficial, effective, and therapeutic effects on inflammatory pulmonary pathologies. So I ask you everybody, so we are trying to use this. We are using this a lot, in fact, in patients after COVID or patients that are recovering from COVID-19 with very good results. So I ask you that could it be used, or could laser therapy, can laser therapy help the treatment of pulmonary inflammation in COVID-19 infection? So I should say that in Brazil, just like in other countries, COVID-19, it's the people are, it's a very political situation. And but yes, we have some things besides pharmacological agent that can help patient to recover from the pandemics, to recover from lung inflammation. So laser therapy works in all kinds of lung inflammation. So I showed you all kinds of lung inflammation, including COVID-19 inflammation. So yes, we can use laser therapy as a new technology, as a new tool, or a coadjuvant tool or treatment to help in COVID pandemics. I think that's it for now. And thank you very much for the patience. I'm sorry for my English, but I think that my Spanish would be much worse. So thank you very much. Those are my contacts. We have the Instagram profile and also the YouTube channel. And also, if you want to contact me, you have my email, my personal email in the Gmail. So feel free to send me any kind of questions, of contacts, of anything. Thank you very much. It's a great pleasure. It's a great honor to me to be here with you in this Congress. And again, I would like to thank the organizing committee for the opportunity. Thank you very much.
Listo. Agradecemos mucho su participación, ingeniero Rodrigo. Una vez más, hacemos recuerdo a todos los participantes que si tienen alguna consulta, alguna duda, pueden hacerlo a través del módulo de preguntas y respuestas o inclusive también por el módulo de chat. Tenemos más o menos unos 10 minutos para esperar en cuanto a sus dudas, consultas o de repente algún aporte que tengan, ¿no?
I think that maybe the engineering doesn't like much the COVID, but that's yeah. I think that laser therapy has a lot to contribute for the new medicine, and yeah. But feel free to send me any question. If you want to send me some message in the future, or you can send me anytime that I answer everybody. No, it's not expensive. I'm telling you, is this type of treatment expensive? No, you just need the equipment. You don't use any kind of drug. So you just need to have the equipment. So it's not very expensive. We are using, for example, for home treatments, after patient at home to treat COVID sequela, for example, or other kind of inflammation. We use in Brazil, one of those equipments costs around from 3,000 to 5,000 reais. I'm not sure in your currency how much is it, but it's not expensive. We have some interesting equipment in the United States as well. For example, I work with equipment from the one company, I think it's a class 4 laser from Sumus Laser. That is very interesting because we have a higher energy if you irradiate the lungs or the backs of the patient transcutaneously, so we have more energy to irradiate. But we can treat with low power lasers as well, and we are using a lot in the artery. I know that sometimes that I studied laser therapy in the last 24 years. As you mentioned in the beginning, I was the president of the World Association, and the first time I saw laser, I was very skeptical to laser therapy. So I was trained in pharmacology. My master, PhD, a postdoctoral, a fellow, my full professorship and everything was in pharmacology. So I was very adapted or familiar with pharmacology, and everything for me was drugs and drug receptor interaction. And the first time that I saw laser therapy, I thought, come on, it's just a light. I don't believe that. I would just believe if I do the experiments. So I start to do the experiments, and in the first set of experiments in rats, so there is no placebo. So and then I said, come on, it was effective to inhibit, for example, more than 50% of the inflammatory reaction in the classical models of rat paw edema. That's a very classical model in inflammation. Then I said, wow, this was in 1999, I think. So I started to study laser therapy very much, and I think I was one of the first scientists to demonstrate a lot of mechanisms in laser therapy, like cyclooxygenase inhibition, like cell migration, and TNF-alpha inhibition, and several mechanisms. And I still working with laser therapy. And when people ask me, but does laser therapy work for everything? I said, no, it works very well when you have inflammatory conditions. So laser therapy is very effective to treat inflammatory conditions. So I think we have other question. Lung cancer? No, I don't think so. In fact, laser radiation can increase cell proliferation. So what we say for cancer patients that I don't think can be used in cancer patients with active cancer. We can use in oral mucositis. We use a lot for oral mucositis after chemotherapy and radiotherapy. So we use a lot of laser therapy. So in fact, it's the only thing that treats oral mucositis. So we use this around the world. We use a lot in Brazil. We use in France. So where are the studies done? Is there participation from doctors? Yes. We have, of course, this treatment to serve to cure lung cancer. No. How do they measure inflammation levels? It depends on, I showed a lot of markers. We studied gene expression. We measure by ELISA all the inflammatory mediators. We measure a cell, we do the cell counts. So all kinds of inflammatory disease. Aplicável inflamação por trauma. See, definitely. We use in all kinds of inflammatory musculoskeletal disease are very well treated with laser therapy. We treat tendinitis, we treat osteoarthritis, we treat low back pain, we treat neck pain. Just to mention, for example, we published in 2009 one paper at the Lancet Journal. We published. That's from me and other 3 authors, friends of me. Professor Roberta Shaw was the first author from Australia. Professor Mark Johnson from Leeds in England. Professor Jan Bjordo in Norway, and me. So we published in the Lancet Journal, the first full paper in a big journal that laser therapy was effective to treat neck pain. So it was a systematic review with thousands of patients. We also published in the Brit Medical Journal and several big journals. We have, as I told you, we have 51 years of a study, more than 15,000 papers published with laser therapy. So I know that in the mainstream medicine, sometimes laser therapy is not disseminated because the medical doctors, they tend to only use medicines, pharmacological agents. But it's not their fault, because I teach in the medical school. I teach in the medical school for the last 20 years, at least 20 years in the medical school. I teach pharmacology. So if you see in the medical school, medical doctors, they just have pharmacology in the curriculum. They don't study anything else in therapeutics. So when we show you electrophysical agents with beneficial effects in several diseases, so we have a lot of restrictions. But now, after 51 years of research and more than 15,000 papers published, we can say that laser therapy is not an alternative medicine. So it's, how can I say, consolidated treatment. And of course, that when we say, when it speaks something about COVID, as I told you, COVID is a very political thing, and nobody can touch COVID. That's, but for example, I mentioned to you that we tried to perform a big clinical trial with patients with COVID-19, and so we were prohibited to do this kind of in 4 hospitals. We tried in 4 hospitals, and we were not allowed to perform the clinical trials, even with 20 years of scientific evidence of laser therapy in lung disease. So even when you show all of the evidence, dozens of papers. So we also have a lot of papers from me, from different groups around the world. So we have all kind of proofs that laser therapy could be helpful to treat COVID sequelae. So when we were not allowed to perform the clinical trials. So it's difficult. But in other pathologies, inflammatory pathologies, that we use a lot. And I am a professor at in Norway, from the Bergen University and Bergen University College since 2004. And I am responsible to teach pharmacology for the postgraduate students and master and PhD, the students from physiotherapy and other manual therapy and other careers. And we do research in laser therapy together with the Norwegian University in the last 17 years, and we published more than 100 papers together. So, so I'm pretty sure about what I'm saying. And so if you want to know more about laser therapy, just send me a message. So what do you think? They were not allowed to do the clinical tests? Good question. In fact, the medical doctors, they want to do, but the lawyers of the hospital prohibited the clinical trial. So, I don't need to say anything else about this. So we were prohibited by the lawyers, not by the medical doctors. Okay. La potencia y el tiempo de irradiación es única variable y cómo la determinan. Okay, so we already have a lot of studies. We have some parameters to it's the most difficult thing to work with electrophysical agents are the parameters. So when you use a drug, you just swallow the drug, because everything was already done previously before the drug, before the medicine comes to the market or to the pharmacy. But when we work with electrophysical agents, So we are trying to establish some patterns. And since 2006, at the World Association for Laser Therapy, we published there some guidelines of dosage. So if you go to the WALT, W-A-L-T website, we have the dosage tables that were based on the clinical trials. So everything's based on scientific studies. So we have the energy doses, we have the fluences. I told you that yes, potency matters, it's important, but we use energy dose, total energy in joules, as the main parameter to establish the therapy. So we have different energies to treat pain, to control pain, acute pain or chronic pain, or different intensities of pain. We use different energies to heal in wound healing. So I show you several hundreds of papers showing that laser therapy. In fact, in 1970, the first demonstration of the biological effects of laser therapy was done in wound healing. So we have 51 years of studies in wound healing. So I tell you that the only thing that heals, for example, diabetic ulcers, feet, is laser therapy. So chronic ulcers, chronic venous ulcers, it respond very well to laser therapy. Potency matters, but energy dose is the main point. Irradiance is important. For example, if you want to prevent some heating effects, it's important to pay attention. It's important to pay attention in the skin colors as well. It's important to pay attention in tattoos as well, because you can burn the skin. So there are a lot of things. But if you want to know all kinds of things, we can go to my Instagram or my YouTube channels. That I have a lot of things there. I have lives every week on Tuesday night. So and I can answer you everything you want.